have tan I have tan skin and glasses, and I am wearing a teal colored hijab or headscarf. So hi, I'm so excited to welcome you all to this incredible opportunity that our amazing partners at APHA have provided for us. I'm really here to just to kind of kick us off and say hi. But I was really glad to do so because I think this is a really exciting opportunity. Obviously, going to the APHA annual meeting would be really cool, but I also think that this whole process of kind of thinking about your work and articulating it for external audiences is really, really important, whether it's something that you do to hopefully go to a conference or whether it's something that you do just telling other people about your work. Maybe you're talking about your resume, maybe you're networking. I think it's a skill that as a public health professional, you will have to kind of exercise over and over. So I think it's really cool that we're doing that here. I will be back to chat a little bit later about kind of my experience coming up through a public health training program, not unlike this one, and hopefully to help you guys start thinking about what you might want to write about. But for now, I'm going to turn it over to Chris, who we're so excited to have join us today.
Hello, everyone. My name is Chris Chanya-Selkett, and I'm president of APHA. I'm also an Asian American woman, and I have blue glasses on and long black brown hair. And then I also want to start, just to begin us and ground us, with a land acknowledgement. So we're gathered, or I am gathered here with a lot of folks from APHA virtually today on the traditional land of the First Peoples of the District of Columbia. The Piscataway, who inhabited the region between the Potomac and the Anacostia rivers. They were the original inhabitants for thousands of years. And so we honor their history, and we would like to express our gratitude for their land, which has provided us with this bounty and this opportunity. So really quickly, again, my name is Chris Chanya-Selkett, and I'm president of APHA. What is APHA? It's the American Public Health Association, right? 150 years we have been around APHA as of last year. So fun fact, I didn't actually know we were around for that long. I was like, oh, but I have learned we celebrated a huge party last year at our annual meeting for 150 years. But we are the leading professional society for any folks who are interested in being in our public health. And really everything is public health. So this is the professional society to be in. And I like to say that, we're nonpartisan. We'll put it out there. We're here for the people's health, and we're an advocacy organization looking to advocate so that we can have healthier communities here, there, and everywhere. So I just wanted to say hello for a little bit, and they asked, hey, Chris, president of APHA, can you talk at this AmeriCorps program? And I said, well, first off, obviously, yes, I can't say no to anything. But secondly, I don't know if you know, but I was an AmeriCorps alum. So I was you, and I love being an AmeriCorps. Like, aside from the free t-shirts and all those good things and the fun orientation events, I know, right, Jess, I see your heart. Like, AmeriCorps is part of my family. I did it I won't tell you too much, the late 90s, early 2000s. I did AmeriCorps, and I did it when I was in Boston, which is also where I generally reside. I did it in Boston, and my year of service was incredible. It was after college. I got to work with community nonprofits all around the greater Boston area, but I got to do it with this great cohort of AmeriCorps friends of all different ages and race and ethnicities and backgrounds. I will be totally honest with you. Many of those AmeriCorps volunteers are still my good friends now. We have gone to each other's weddings, we have met each other's babies, and maybe now our babies are not such babies anymore. But I have such great times with them, and seeing them, I said, well, of course I have to talk because AmeriCorps is my family. So to all of you who are there now, welcome to my family too. We're going to catch up. We'll have our family reunion at the APHA annual meeting. So I'm going to say it now before I forget, is I hope to see you all at the annual meeting, because for me, that is my public health reunion family, but now it's also my AmeriCorps one. And I would love it if maybe Raya and Angie, you could help us. Maybe we could all have like a big gathering and take pictures, because, hey, if we didn't take a picture and post it, did it happen? Right? No, I'm just kidding. But no, I'd love to get together and meet all of you. Because I thank you for your year of service. So, back in the day, I did AmeriCorps, and this was after college. I went to BU, And just so you know, again, Asian American, first generation. My parents said I was going to be a doctor. I'm not a doctor. They said you're going to medical school. I was like, oh my God, I can't handle the sight of blood. So I said, I need to just take some time for myself, did AmeriCorps for the year, met all these community nonprofits, and then realized, you know what? I love health. I'm not doing surgery, but I want to do public health because my heart is in making our communities healthier. And I cannot stand the sight of blood. So it's perfect. So I do my AmeriCorps year. I fell in love with everything I did in that area of Greater Boston. I ended up staying and getting my master's in public health in Boston after AmeriCorps. And I used that awesome educational stipend and put it towards my grad school loan. So it was like a win-win. But I will also say that the connections that I made during my year of service as AmeriCorps very much continued to grow and deepen during my time getting my graduate degree in public health, and then to still now. So, I mean, I can almost really not separate my AmeriCorps versus my public health experience. So, I am excited for everything that's ahead of you. Know that you can always reach out to me. I can try to put in the chat, or maybe Raya can. I'm at president@apha.org. I'm on social media. I'm here for you. And I want to see you in person at the annual meeting. So really quickly, what do I do as the American Public Health Association president? I get to go all across the nation. And so I was watching you all type in the chat, you're Texas, in DC as well, I think Michael said, and everyone's from everywhere, all across the nation. Well, I am thankful for this opportunity as president to go all across the nation and visit all of our statewide public health associations everywhere, and to bring our message of health equity and to speak for health all across our nation, to get more folks being a part of our public health movement, just as you are as the Public Health AmeriCorps members. And I love it. It's an honor. Hopefully I'll get to meet you when I go to your state, but don't ever hesitate to reach out to me. So, really quickly, the annual meeting, oh my God, it's so fun. So APHA, again, is a member organization. We have about 50,000 members. I know that's a lot. Don't worry, they don't all show up at the annual meeting because that would just be like bonkers. That's a technical term, bonkers. So at this annual meeting, we usually have, I would say, maybe 13,000 people come to the annual meeting. That's still huge, but you know what? We have all these smaller breakout sessions, and we have scientific sessions, and you can give your scientific session. When I did my dissertation and my research, I actually got to present my dissertation research at APHA. I was super nervous. I wore student heels, and I can't walk in heels. It was terrible, but I did it, and I was so proud, and I presented, and hopefully you will present as well. And if you present and you're AmeriCorps, email me. I will do my level best to stop by at your scientific session, poster session. I love that. I love nothing more than meeting more members of my family. It is fun, but yes, there's all this great science. But the annual meeting for me has also been where I have met friends who have then become family. I mean, there are folks that I had met when I was really young, and they pulled me aside and said, you don't need to wear heels in this convention center. Are you crazy? And I was like, thank God, because I really can't walk. And they mentored me, and I was like, bring Birkenstocks. And sneakers. And, I think at one point I felt like the convention center was so big, I wanted to borrow a scooter, those Lime scooters, but fun fact, they're not allowed inside the convention center. Should any of you try that? I've done that. Don't do that. It's a wonderful annual meeting, and that's where I got to meet folks. And aside from these incredible public health leaders and colleagues that I made friends with and learned from, I'm going to be honest with you, as someone who, I got 3 kids and the price of eggs is going up, and the burritos, my gosh, my kids eat too much now. As they get bigger, they eat more. It's complicated. So I know we needed, I know work, right? And I want you to have that good networking experience. I will be flat out honest with you, at APHA, aside from making friends and colleagues, I also was able to really connect with folks who helped me with whether it was learning how to use social media, polishing my CV, making connections to make connections so that it was easier when I finished my graduate degree. Instead of just randomly putting my resume out on the internet, I could actually contact someone who then kind of nudged my resume to where it needed to go. because I will be honest, like the job market is not fun, and sending it out in those databases is just kind of depressing. But it's a lot easier when you reach out to your APHA family and they're like, oh, hey, Des, you're awesome. We need to help you get a job. I know the exact place that you need to be, right? Andrew, Taylor, Andrea, Angelina, like all of you, we know that we're here, and it's a connection and it's a network. So you can go, you can meet them in person, you can get a mentor and be a mentor through APHA, and then continue that relationship, maybe mentoring through the year as well, because we do lots of stuff like this virtually and in person. We have a policy think tank coming up in June. Join us then if you want. Especially, I think, Andrew, you're here in DC, like you should be signing up for the June policy think tank. But whatever it is, I think of the APHA annual meeting for me as a one-stop shop. It's a place where I can meet, make new friends, get connections for just, not only just making new friends, but also really to help me later when I need to find that job because the cost of eggs is going up. And then also, honestly, fun. I love Zoom. I love seeing you on Zoom, but so much more, I'm ready to see you in person, because seriously, like we've gone to conferences on Zoom. Like I'm usually in sweatpants and then I might fall asleep. Shh, don't tell anyone. Or zone out or decide to take my dog for a walk. But when you're in a conference and you're there with each other, you feel the energy, you feel the inspiration, and you make those connections. So I think I'm probably out of time. Sorry to go on. They're gonna, oh my gosh, don't hate me, Ryan, everyone. But I want to see you all November 12th. Okay. And this is the year that I'm president. And if you don't know anything about me, I'm going to tell you right now, my year is to tell everyone to play for health, read for health, and vote for health. So join me in Atlanta so we can do some good play for health. Okay. I'll see you soon. Thank you.
Great. Thank you so much, Chris. We'll turn it over to Fran and Nancy from our APHA membership department now.
Awesome. Here's Sayo. Okay. Hello, everyone. My name is Fran Atkinson. I am the Deputy Director of Membership Services. I am an African-American woman with short curly hair and glasses. And I think the theme of the day is glasses, from what everybody has described themselves. So there's that. I'm going to run through this pretty quickly. I wanted to talk about the many benefits with being an APHA member, but bring it back to the annual meeting. So as Chris mentioned, we have been around for over 150 years and always addressing, making sure that we are the collective voice for public health. And our mission and vision, our mission is to improve the health of the public and achieve health equity. And our vision is to create the healthiest nation in one generation. As I said, I'm just running through this because I want to get to the important piece of it. This is our strategic plan. This is going to be changing. Our executive board was in this weekend, and they're looking at modifying this, but it is 3 buckets that we focus on as far as strengthening public health practice, building a public health movement, and aligning organizational capacity and infrastructure. And with you in AmeriCorps, you hit all 3 buckets. So that's what Raya and Angie are working with you on, as far as making sure that we do support a diverse public health workforce, as well as also advancing health in all policies, strengthening our core, and then just our part of it is working on the admin side, working with you to get the information out about public health. And there's Chris. Doesn't she look lovely? Yay. And these are our 23 advocacy priorities, and they don't change that much from year to year. we are always working on making sure that there's proper funding for the CDC as well as HRSA we work closely with. We are always working on upholding the Affordable Care Act. That doesn't change. Climate change has been on this list for like maybe 15 years when folks didn't even realize how climate change impacted health. Some of the other items is like looking at like trying to address the nation's gun violence epidemic. Also this year, looking at making sure the Farm Bill has strong nutrition and public health provisions, also addressing reproductive health, and also prioritizing racial and health equity through each priority area. We have a couple of campaigns. I would encourage you to go on our site to check them out. But I did want to really focus on what the benefits are of being an APHA member. So as an APHA member, you receive the top journal within public health, which is the American Journal of Public Health. You receive that, I think it's like 9 times in the year. And then the Nation's Health is our official newspaper, and you get that 10 times during the year. In addition, we have APHA Press and the bookstore, in which as a member, you have significant discounts. I am looking forward to a book coming out this fall that focuses on maternal health in the African American women's community. So like a lot of the books that we publish, they are timely as far as what's occurring right now, as well as like as a member, you receive Inside Public Health, which is an online, which is an e-newsletter to our members. And then, of course, legislative updates, which provides information on what we're doing in terms of advocacy, which is a lot. That we do a lot in terms of professional development, and that's at the annual meeting and outside the annual meeting. So Chris mentioned that we have the Policy Action Institute, and that will be taking place next month, in which it provides information as far as like addressing policy. And then the second day is how to advocate for these policies. So it will be a fun time, that's for sure. Again, it is in DC. So the folks that are in the area definitely consider joining us. And then the annual meeting. As Chris said, I'm not going to go through it again, but like we do get about like 10 to 12,000 people. We have over 1,000 scientific sessions. We have programs crafted by members. So one of the things that I will say is that everything that we do at APHA is done with the help of our volunteers. There are only 75 staff members, but we have over 1,000 volunteers. So they are the ones that will put together the programs, the sessions, all of that. So these are like some of like all the benefits that you'll be getting when you do attend the annual meeting. And then I just wanted to quickly go through that. As an APHA member, you do get other benefits. So like big interview for those that would be looking to practice your interviewing skills. This is one of the best platforms to do it on, and it's free for APHA members, in which you can record yourself and then share the recording with your friends, get their feedback. Also, we have leaders that have put in questions, so you can use those questions to respond and again see how you do. So that is a huge benefit. Also, we have other benefits like Hertz, partnership, but also we have Savvy, and Savvy is for a nominal fee, you can pay them and it will assist you in finding ways to pay back student loans or find lower interest rates. So it's a great opportunity. And we also have Career Mart, and I would definitely recommend that you check out Public Health Career Mart if you're going to be looking for any employment opportunities in the future. I mentioned that. And then one of the biggest things, and this is where I really want to focus on, is the networking opportunities. And you can't beat being at APHA for the networking. So we did create a new online community last year, and it enables members to communicate with one another, meet one another, go into a directory and see if anyone's in your city, connect on different issues, as well as we also just added a few more components to it, where we now have something called Mentor Match. So you can find a mentor through the system, or you can become a mentor through the system. And you have the ability to connect with all our members. And we have about 24,000 members at this time. And then this is what LEAD stands for. And I'm just gonna run right through. So what I really want to connect with you with is APHA has over 60-odd groups, and this is where you find your family. I really have to say that when you go to the annual meeting, it really is like a family reunion. And part of what makes up the family are these different groups. So we have 33 sections, 5 forums, 17 caucuses, 6 topical groups, and 1 student assembly. And if you cannot find a group that interests you, you got to let me know. So you might be asking, what are the differences? So sections are APHA groups, and they focus on a field in public health or a profession in public health. So you'll see that we have the environment section, we have health admin, and then profession, public health, nursing, public health, social work. So there's definitely a home there. And the sections are the main groups that put together the annual meeting and the scientific sessions. So by getting involved in these groups, by getting involved with the leadership, you're able to network with folks that have the same interest as you. And they are in the field, doing as far as also some of the leaders in the field. So you could definitely start with sections. If you're a member, you receive 2 sections. And if you want to join additional ones, there's a small fee of $15. So those are the sections, 33 of them. And then we have something called forums. And these are groups that cut across all the different sections. So I'll give you an example. Breastfeeding, you will find maternal and child health, food and nutrition, international health, all coming together to discuss the issue of breastfeeding, and then bringing that information back to their sections. So we have forums that you can get involved in. And then we recently we've had topical groups where they do about 2 scientific sessions, a webinar, and they have an online community. And these are hot topics that have come up over the last 4 to 5 years. Of course, climate change, emergency preparedness, gun violence prevention, opioids, as well as suicide prevention and rural health. And they're really very active and always looking for members to join them and participate in the conversation. So that's another group, as well as we have caucuses. And what I would say with the caucuses is that they are not part of APHA, but they are affiliated with APHA. And there's 2 types of caucuses. One type allows caucuses to coalesce around shared identities or membership in social groups. So you'll see that, like, we'll have the Latino caucus, Asian Pacific Islander, as well as when you're looking at social issues, we'll have the homelessness caucus as well as the peace caucus. And these, again, are separate groups, but they participate with APHA and create scientific sessions. I'd encourage, like, if you're interested in any of these caucuses, like, I will put the link to the main caucus page after this. So just giving you some thoughts as far as like how to get involved. And then we do have something called the Student Assembly. So about 1/3 of our membership, we have nearly 8,000 students, and those 8,000 students are in the Student Assembly. Sorry, over 7,000. It's like 7,800 at this point, rounded up. And they are a powerhouse. So if you are a current student, I can't stress enough that you should consider getting involved in the Student Assembly. They have like about 15 different committees. They have multiple opportunities. And like one of the big things that APHA has done, and we've been doing again for like maybe 20 years, is that making sure that we have a student leader on every single APHA committee or board. So we always have that student voice. So multiple opportunities, as well as, like, if any, I would encourage, if you are going to the annual meeting, to maybe come a day early. On the Saturday, the students always have a national student meeting, and they have panels, as well as they have networking opportunities. They have speed mentoring. So I can't stress enough, like, if you are coming, consider coming on the Friday versus the Saturday, because like the Saturday there is the national student meeting, and it's like, I think it might be like $15 to register, something small, but like the amount of knowledge as well as networking opportunities is fantastic. And I'm just gonna quickly go through, and I'm gonna just have Nancy speak at this point and see if there's any questions. Stop sharing. Okay, Nancy.
Awesome. Were there any questions for Fran? If not, I can just go ahead and talk just really briefly. I know we have a lot of content to get to during this webinar, so I'll just talk a couple of minutes about the member group of early career professionals. So I'll have kind of 2 topics. I'll tell you what the ECP, the early career professional, is as a member group in APHA, and then I'll touch on the specific events at the annual meeting that you can take advantage of when hopefully you're all there in November in Atlanta. So first of all, Fran already mentioned that we have a very active student group. After you graduate, you then migrate hopefully into the early career professional group. This member group is also discounted as the student membership is. So you can be an ECP for 3 consecutive years, and you can join that member group for up to 2 years after you graduate. There are a lot of specialized member benefits for ECPs, including a lot of things that I'll tell you about in a minute in regard to the annual meeting. There is a specific online community, as Fran was talking about with APHA Lead. Along with the sections having their own communities, the ECPs also have their own community to network on APHA Lead. And there are specialized webinars and opportunities throughout the year for ECPs to give you kind of that added boost at the beginning of your public health career. APHA really does try and focus on walking alongside you as you go through your public health career. And I just realized I didn't really go into detail and introduce myself. My name is Nancy Sherwood. I'm a colleague of Fran's in the membership department. I'm a Caucasian lady with long red hair, and I'm currently wearing headphones. So I apologize, I didn't do that at the beginning. So I just went over the ECP definition there, and now I'll go into the annual meeting special events. We have a couple of baseline events that we do every year, and we try and augment those events as we go along. We always try to up our game for our members because we know you have needs, and we appreciate the fact that you come to our annual meeting, that you invest your time and money in that event. So we want to make it worth your while. Early career professionals have two big events at the annual meeting. First of all, ECPs have their own poster sessions. That's actually something that came about as a suggestion from ECP members themselves. This is our 6th year of offering ECP specific poster sessions, and it gets bigger every year. We started out with, single digit submissions, and now we're up into the 30s. I think we have 32 posters that were submitted this year for the ECP poster sessions. So those poster sessions will be in the expo hall. So if you have a chance, do stop by in Atlanta in the expo hall. We also have on Monday mornings, we have an ECP workshop. That's also something that has grown over the years. It started out as a 1-hour workshop on job search strategies. And now we have a 3-hour workshop. It's actually segmented into 3 sections, 1 hour apiece with a little break in between. So those topics of those 3 sessions on Monday morning from 8:30 to 11:30 can be anywhere from job search strategies to salary negotiation to specific public health career advice. And we also do some personal career development topics on that workshop as well. And I'm currently working on doing a little bit more activities in the expo hall for our ECPs at the annual meeting. But we're always looking for suggestions. So if any of you guys are members, please reach out to me. I'll type in my email address and just in a minute after I stop talking. But we definitely want to encourage you to look us up in the ECP workshop, look at the poster sessions at the annual meeting. We'll have some expo hall events for emerging leaders and in the industry expert theater. So as you start to sign up for the annual meeting this summer, hopefully you can actually search for ECP events in the search field when you go to your online schedule. So that's pretty much all I had for today. I know we have a lot of content, so I'll stop there. But if there's any questions, I'll chat in my email. And I appreciate your attention.
And Nancy, I
Amazing.
just put in your email information as well as the site for ECP under our membership site. So hopefully that will help.
Great. Thank you both so much. And of course, if anybody has any questions, please feel free to pop them in the chat. I will turn it over to Christy.
Thank you so much, Raya. So we've talked a lot about the annual conference, and so I just wanted to give some of my insights on the experience. And just for some trivia, in 1873, the first conference was in Cincinnati, Ohio. And here we are 150 plus years later, joining in Atlanta in November. So I do encourage you all to participate and give it your all. As you can see, we have Dr. Benjamin, who is speaking on the platform as one of the annual members. And so the conference is really great, especially in my case. I am a Black Caucus health worker through the caucus and also a student assembly member. And so with those opportunities of being in the room, of having these conversations about public health in real time and in candid ways, I think that it creates opportunity for people to really understand public health in a real way and in something that is interconnected to all the experiences we have in our careers. So with the annual conference, also important to mention too, that as you are all in AmeriCorps and matriculating through the process in your service sites, I do want you all to begin to think about with the context of our topic this year, which is looking at creating a healthier nation with our services and ethical changes, how do we actually take our AmeriCorps experiences and transfer them into the annual meeting platform? How do we discuss our topics in a very scientifically ethical way, but also in a way that's fun and engaging and keeps people entertained and keeps people understanding more about your public health journey? So with that, I just want to, conclude that with the annual conference, please make sure that you have the contacts that you need to make sure that you matriculate properly through the conference. It is 3 days. It's a very robust experience, but it's also something where you all can share knowledge and share opportunities to network and engage. From that, I will turn it over to Raya so she can give us a little more about these scholarship opportunities.
Great. So you'll see on the slides here just a few other photos from the annual meeting. Thanks, Christy, for that introduction. Thanks all to everybody who's shared so far. My name's Raya. I use she, her pronouns, and I work at APHA as a program manager. I am a white woman with very blonde hair sitting in a beige room wearing a red shirt. I also have glasses. Theme of the day is glasses. So just a quick photo to kind of preview for you what these poster sessions look like. We'll talk a little bit about the poster sessions in just a moment too. So this is a great way to engage and to, as Christy mentioned, start thinking about how you can use your experience in AmeriCorps and present it to folks at the annual conference. So one of the main reasons we're all here today probably is to talk about these scholarships to the annual meeting that we are providing. So just to reiterate some of the things we talked about in our very first webinar, the scholarships that we are offering you all as AmeriCorps members do cover all costs associated with the annual conference, including transportation, housing, registration for the conference, and meals when you're there. In exchange, or to enhance your experience at the annual meeting, if you will, we'll want you to participate in poster sessions similar to the ones that I just showed photos of. And we will continue with these biweekly informational webinars to kind of support you in that process as you think about developing your poster session and your abstract prior to that. Applications for the annual meeting scholarship are due June 9th. So just a little bit more about what you'll need to do. So in terms of submitting your application, you will be asked to submit an application that includes your abstract as well as some kind of just demographic information and just a little bit more information about yourself and your experience at AmeriCorps. The process to submit abstracts will be very similar or it will be parallel to the process that folks normally do submit abstracts through APHA. However, we've kind of tailored the experience a little bit to fit the needs of Public Health AmeriCorps folks. And then, of course, during the annual meeting, we'll want you to make the most of your experience by attending the wonderful events that I'll just share briefly a little bit more about. So during the annual conference, we'll be having a welcome session specifically for Public Health AmeriCorps attendees. And as Chris mentioned, we definitely want you to attend those sort of things and hopefully get a chance to meet everybody in person. There'll be a number of different other opportunities and events, including networking. As Nancy mentioned, of course, all of the early career professional items and events that they're doing will be wonderful to attend as well. And of course, scientific sessions to learn more about, emerging public health topics. And then, of course, majorly we'll have poster sessions as well that you will be participating in. So there's another picture of what that might look like. So what those poster sessions kind of look like, a little bit zoomed out on the screen there. That is essentially all I wanted to cover in terms of the application process for today. I'm going to turn it back over to Munira, but of course, if you have questions about the application or about the meeting at all, please feel free to put those in the chat and we can get to them. Just thinking off the top of my head, I remember we had a question submitted in the pre-registration about our, if there are multiple folks from if there's multiple members at one site, do you have to submit multiple applications? So yes, every individual will have to submit their own application. And we have about 20 to 30 seats that we're hoping to bring individuals for. Of course, any other questions, please feel free to put them in the chat, and I will hand it back over to Munira.
Hi all, thank you so much, Raya, Christy, and all for telling us a little bit more about APHA, the annual meeting, and what the specific application process will look like. As promised, I'm back. Before I kind of get into my recommendations for y'all, just want to tell you a little bit about why I'm here. I'm not an abstract expert by any means, but I was in your position not too long ago. I myself came up through a public health training program, not unlike PHA. I was with the CDC at the time, and we kind of had to do the same thing. Oh, sorry, dropping a one. Yay, very excited. Okay. So we kind of had to do the same thing. I had to write an abstract. I had to think about my work, and I wanted to pass along kind of the wisdom that was passed to me to y'all. So certainly you don't have to take these recommendations, but having been in your position, this is what kind of helped me think through it. Also, I must say, when I was in my training program, I did have to write an abstract, but the end product of my abstract was not a scholarship opportunity to potentially get to go to APHA. So this is way cooler. I'm a little bit jealous, but very excited for y'all. Okay. So as I mentioned, the application process, nothing crazy. It'll be submitting your abstract, answering a couple questions about yourself, your project, and telling us how attendance will support your career trajectory. So like, tell us about yourself, why you want to go, all that fun stuff. I want to talk to you guys about picking a project. A couple things to consider. First being, if you're here, you do have a project worth presenting. I know when I was writing my abstract, I was like, oh, I don't have any quantitative data. Like, what do you do with a poster? It's scientific. No one's going to want to hear from me, you know? I'm here to assure you that if you're here, if you're a Public Health AmeriCorps member, you do have a project worth writing about and worth presenting. And I can say that with full confidence. I read all about your work. I spend a lot of my day trying to figure out how to capture your work. So yes, be very confident in yourselves that due to the work that you do, you have something worth presenting at APHA and any professional conference. Okay. Second kind of suggestion I have from y'all, again, based on my experience, is to think about the work that you do. It's really easy, I think, sometimes to kind of think about like the whole project at your site. And, you know, that might involve many different offices that have nothing to do with you. So ground yourself in your work and your day-to-day. And lastly, the kind of last piece I want to mention to you all here, if you have time, the annual meeting is in November, so you might have just started, or you might be a couple months into a project and you don't really know where it's going to go yet. That's okay. That can be reflected in your abstract. You can say, this is what we're doing, and I want to present about the results, and you know, it'll come. So don't feel like you need to have a fully fleshed out and completed project that you're going to present on by June 9th, I think we said it was. We understand that projects are ongoing. So those are just some considerations I want y'all to think about. And then next slide, please. Thank you. Here are some key questions that I kind of went through when I was in your position. I wanted to pass along to y'all. We had kind of a little activity, but I think given time, I'll just kind of go through an example and we won't have to, you're spared. I won't call on you guys or ask y'all to volunteer. So this is kind of your homework assignment. If you're having trouble picking a project, if you already know what you're doing, no worries. But if you're having trouble picking a project, here's what I want you to think about in the next 2 weeks before we meet again. 1, what activities are you doing? It can be as boring as, not boring, but as straightforward as I'm writing emails today. You might think like, you know, how do I turn that into a poster? Hold tight. I want you to think about your audience. So who are you doing your activities for? Think about impact. Why are you doing what you're doing? And lastly, think about lessons learned. How could this inform other projects? So an example I will go through with y'all is what I'm doing right now. We'll go back in time to me last week. What was I doing? I was making PowerPoint slides, right? Literally, just that's what I was doing that day. Maybe at first glance does not sound like something you would want to talk about at a poster, but as you kind of go through these next questions, I think the project will start to flush out. So who was my audience? The audience was you wonderful people, right? Why was I doing it? This is kind of where it starts to get interesting. Well, I was doing it to support our wonderful partners, APHA, in providing this professional development opportunity for you all, and lessons learned. How could this inform other projects? Well, that's kind of a big question, right? Professional development is a big thing in the world of public health. You may have heard public health is projected to have pretty intense personnel needs. So a lot of people are going to be interested in how can we develop a public health workforce. So that kind of takes us from like, okay, I was developing a PowerPoint to, okay, now I'm working on a project that could impact other people. So my kind of day-to-day of I was working on PowerPoint might come to, okay, well, I am partnering with APHA to help provide professional development opportunities to support a new public health workforce. So maybe my abstract is about, governmental and non-governmental partnerships in creating viable workforce development opportunities, right? So we kind of go from like the very minutia of your day to I'm making a PowerPoint to how can we kind of take a step back, think about what we do, the impact, and what other people might glean from it. Again, I really want to reiterate that all of you and the work that you do, you can do this process. If you're struggling, you don't have to go through this. Maybe you already know what you want to do. Maybe these questions aren't helpful for you. You can talk to people at your site. You can talk to your mentors, whatever it might be. But these are questions that have helped me, and I hope they're helpful to you too. Okay, I will pass this back over now, I believe, to Raya.
Awesome. Thank you so much, Manira. And I think I will actually pass it back over to Christy.
Thanks, Raya. Thanks, Manira. And I hope that that was helpful to you all. Manira gave us a very great way to break down some ideas of what we're thinking and who our audience is and how the impact lies in the conference. So I hope that that was helpful. I do want to pin our future webinar coming up May 16th. So this topic will be how to actually write your abstracts. So as you're thinking about what topics you want to do for the conference, this meeting will really cover how to actually formalize the abstract, what details to put in the abstract, and how we can all come together to create the abstract as one. So please register for the next webinar. We have the QR code there, and also in the chat, we have the link. If there are any questions, please do not hesitate to reach out. We should have some office hours as well to come up. And also that those office hours will just be a way to engage with us on a personal level, ask us very candid questions about your experience in AmeriCorps and also how it relates to your experiences at the annual meeting. If there are no further details, also, yes, the recording and the previous meeting should have been sent already. I'll defer to Raya to make sure that that's accurate.
Yep, yeah, the recording, if you don't have it, I'll put my email in the chat if you were not registered for the previous meeting. You just have to email me and I can send the recording, and or Munira might have a place to put that in an email. However, this recording will be sent out to everybody who registered as well. Yeah, and I'm seeing, I'm gonna go ahead and stop sharing the screen here. I am seeing a question in the chat as well, and we can probably get to a few questions that I've heard come up as well. But in terms of accessing the application, so that's something that we're working with the Public Health AmeriCorps team, our lovely friend Munira, to get out to you all. Once it goes live, you'll get an email and you will have access to that. As we mentioned, the application is due on June 9th. And then we will be making a determination in between then and late June as to who is accepted, and then we'll be in touch, of course, with those who are and those who were not, if that is the case. One other question that we did get was around if you are graduated member, if you're no longer a member of Public Health AmeriCorps, can you still access this opportunity and this scholarship? And the answer to that is yes. You're definitely more than welcome to do that. Anything, Munira? Yeah, go ahead. And then anybody else has questions.
Yeah, absolutely. So you're all here, so you are registered for this call, which means you should get all the future emails. We will put an email together with all of the recordings, with a link to the application process. I see there's a question about NACHO. So we are not the folks to ask about the NACHO conference, unfortunately, but you can share it and I can pass it along to the NACHO folks. So Andrew, I'll message you in a second. So I see that. We will get you to the right person. Yeah, so sorry, looking through our questions again. Yes, the application process, hold tight. You have not missed anything. We will share that with you. For now, your big task is to think about what you would want to write about. And again, we shared a couple questions that could help you think about that. We encourage you to, talk to your supervisor, talk to folks you're working with. Hopefully, I think this is a really good process and exercise and kind of articulating your work, which feels easy, but sometimes can be a little bit of a challenge. So just know that in the process of putting an application together, you are hitting a lot of different professional skills that I think will help you in the future.
Great. Anybody else have any questions for us? Alrighty. Hearing none, we can go ahead and wrap up. I'll stick around for a second to let Munira address the question that came about the NACHO conference in the chat. But thank you all so much for joining us, and we will be in touch soon.
Thank you.